Crest Densify. Crest Densify actively rebuilds tooth density to extend the life of teeth by remineralizing enamel. Densify from Crest, the #1 toothpaste brand in America. Smile, Crest has you covered.
The following is an America Matters media production. The views expressed do not necessarily represent those of the station or its advertisers, although we think they should. But that's the opinion of America Matters Media.
Hi, this is Michelle Perry Roberts with Sierra Integrative Medical Center. I am here today. I'm going to have Dr. Bill Clearfield on with us through Zoom. We're still waiting for him to hop on. So just wanted to let you know that Sierra Integrative Medical Center is basically building a brand new building. We're super excited. So right now we are in a new office just temporarily at Reno Integrative at 6110 Plumas Street, Suite B. So that's, I'm so grateful for them that we were able to just share a building for a couple of months till our new building is being built. So if you have any questions, you can always call the office to make an appointment at 775-828-5388. And one of the other things that we are doing that's super exciting is that we are adding several new doctors, and they are changing. One is actually a doctor of, he's a orthopedic. So one of the best things about him is that he's been in practice for several years, and he is also taking patients, new patients. And then we also have, and also he's doing bioidentical hormones. His name is Dr. Zini. And we have Dr. Aaron. He will be doing all homeopath medicine. And what's nice about that is, like, he definitely has studied over in India. He's worked with several top homeopathic doctors. And what's nice with that is that it's all he does is work with herbs. And it's just been nice to see patients get better. We're also bringing on some other physicians. I can't say that yet because that would spoil what we have happening. But the best part is that we're going to be a full integrative medical practice with all these different physicians who are joining our practice. So, you're going to get the help that you've needed, and wanted to feel your best from top to bottom. So our goal is, to be healthy from the inside out. I've had my own journeys of health where being diagnosed with 7 chronic diseases, nothing was helping me. None of the traditional medicine was helping me. And once I saw Dr. Bruce Fong, he was able to put all my 7 chronic diseases in remission. So there is hope for all of us that are sick. So some of the other things we're going to be doing is opening up an autoimmune disease support group, which is going to help so many people that are struggling, trying to find out their health and what they can do, working with integrative doctors, which is something that so many people, you've gone to a regular doctor for so long and nothing has worked for you. but sometimes you have to get to the root of the problem. You wouldn't believe of how many patients we are seeing that have been diagnosed with MS, chronic fatigue, adrenal fatigue, Hashimoto's, lupus. I mean, the list goes on and on and on. And so once they start, meet with one of our integrative doctors, they're able to do a 6-week treatment and get better. One of the biggest things that we're seeing is people that are coming in wheelchairs, they're out walking. So in 6 weeks, and that's like a miracle with everything we are doing in our clinic. So the excitement is that there is a root to all your problems, and you can get healthy because the body does heal itself. We have lots of testimonies of so many patients that have come from all over the world. And Sierra Integrated Medical Center has been open it's been under different names. It used to be Century Wellness with Dr. Katrina Tang, which was Dr. Fong's mom. And he took over the practice. So we've been in practice for over 35 years, helping people heal and live longer. And that's what's absolutely so helpful for so many people, is getting to the root of your problem, finding solutions to help you be better and feel better. And we want, the thing is that our bodies are so unique, and each body has the opportunity, if given the right opportunity, it can help heal and you'll get healthier.
In Northern Nevada, there's a one-of-a-kind home that provides temporary overnight lodging when veterans or family members are receiving medical care in the Reno area, some from hundreds of miles away. Too often, overnight accommodations are a financial and logistical challenge. Stephanie Tanksley and her husband are veterans who come for treatment from Bishop, California.
We were lucky enough to be connected to the guest house so that I could stay for 10 nights when my husband was in the hospital. So I was able to visit him every day. It was just a blessing.
Veterans Guest House is privately supported by individual and community donations from people like you who recognize our responsibility to support our heroes. And no government money is received for day-to-day operation of the house.
Please support this organization. The Veterans Guest House is an amazing resource for veterans. Supporting this organization is one of the best ways that you can donate your time and your money just to help our veterans and their families.
Find out how you can help at veteransguesthouse.org.
I'm Andrew Saul, Commissioner of Social Security. I'm here to warn you about telephone scammers pretending to be government employees. Some of these scammers may say threatening things like you will be arrested if you don't make payments or provide personal information. Do not fall for these tricks. These calls are not from us. Real Social Security employees will never threaten you for information or money. If you receive a call like this, hang up. Never give the caller your personal information, like your Social Security number or bank account, or send money in any form, cash, gift cards, wire transfers, or prepaid debit cards. Report the call to our law enforcement arm, the Office of the Inspector General at oig.ssa.gov. Share this information with your friends and family.
If you're living with diabetes and using insulin, you know the pain of pricking your fingers over and over again. Ouch! Well, by wearing a small remote device called a continuous glucose monitor, or CGM, you can reduce the pain of pricking your fingers. If you administer insulin 3 or more times per day or use an insulin pump, call now and learn how a CGM can help you.
Painless. No more pricking my finger.
No finger pricks.
convenience. They delivered it free and they took care of all the paperwork.
You can reduce pain right away. Plus, it's accurate, easy to use, and helps you spend more time in range. And if you have insurance, you can get a new CGM at little or no out-of-pocket cost. Call now and get free shipping of your new CGM. Plus, we'll bill your insurance for you. 800-432-8150. 800-432-8150. 800-432-8150. That's 800-432-8150.
At A Proper Fit Footwear in the Reno Town Mall, we've been accomplishing happy feet for over 30 years.
We offer a various range of shoe styles and sizes for both men and women. From all-season shoes and orthotics to work boots and safety shoes, our professional and reliable staff possesses the knowledge to help you find the proper shoes to fit your needs. Hard to fit? Hard to find?
A Proper Fit Footwear is here to give our customers happy feet. We make people aware of potential foot problems as we're sizing their feet, suggesting the right arch support, and guiding them to the proper shoes for their needs.
Stop by A Proper Fit Footwear at 4001 South Virginia Street in the Reno Town Mall today, and allow the owner Mike Jones and our fabulous staff to find the perfect pair of shoes tailored to your specific needs.
A Proper Fit Footwear in the Reno Town Mall, the home of happy feet, where comfort and your feet meet.
Good afternoon. This is Michelle Perry Roberts from Sierra Integrative Medical Center. I am following up with all the wonderful things we're doing. I have Dr. Clearfield. Oh, he's still not here. So we got to figure out what's going on. This has been quite the event today. So the nice thing is Dr. Clearfield, he is located here in Reno, Nevada. He's a bioidentical hormone specialist. He works with patients from he's known as actually the king of hormones. And he helps people. He has a great weight loss program that people are losing so much weight with his program. He's got a lot of secrets for anti-aging. He's been a doctor in Reno for, I think, 15 to 20 years. He has helped so many people of dealing with people, like both men and women have hormone issues. Women go through menopause, men go through buying cars and doing I always say they go on cars and have affairs. That's cracks me up. But the thing is they go through some type of it's called anapause. So once you're treated, you don't have to have hot flashes. You don't have to have sleepless nights. You don't have to lose memory. You don't have to gain weight. So there's so many ways to reset your body. It's so important to reset your body, especially as we get older. And bioidentical hormones is a really great anti-aging way to combat aging. So the goal is to get Dr. Clearfield here by Zoom so I can keep not tell all the secrets that he can do. And one of the things that he also does, he has some major, wonderful machines that definitely can help a woman's face get tighter. He also has the body shape machine that will take and kind of get rid of some of your fat and make it tighter. So what's so nice about having him here in Reno is that he was one of the first doctors in Reno that did the bioidentical hormones. That kind of like made other doctors really think about it. He does it in pellet form. So the nice part is you're not having to take, when I started bioidentical hormones over 20 years ago, when I had my hysterectomy, I used to have to do all these different types of cream. I had a progesterone cream, I had testosterone, and I was an estrogen pills. I mean, it was so confusing. So you never knew what to take. So I mean, I'd put it on, and nobody could figure out what was, some days I felt I did it right. The next days I felt like I did it wrong. And once I did the bioidenticals, it releases over time. And the funny part is the bioidentical hormones are really a part of our whole entire system to get us healthy. So they're made of sweet potatoes. Oh, it looks like he's here. Super excited. We got him on the, is he on now?
On.
Hi, Dr. Clearfield. So nice to have you on the show.
Nice to be here.
So one of the things that I'm so excited about, you're known around Reno as the king of hormones.
Yeah.
And how did you get that title? I want to know the secret of how.
Well, it's kind of a long story. The short version is, hormones are pretty well misunderstood. And when I've been to Reno now for 10 years. And when I got here, it was pretty much a novelty. I had spent about 10 years studying them before I got here. And it was a revelation to lots of the folks who came in to see me that a lot of the symptoms that they were complaining about, especially some memory issues, fatigue, and things along those lines, actually had a hormonal component to it. So we spend most of our time looking at medical issues through what I call a hormone-centric funnel. So all of our questions in our history are in that vein.
And I think you were one of the first doctors really doing pellets in the area.
I'm not so sure about in the area, but I went to a skills workshop in 2003, and I lived in Wilkes-Barre, Pennsylvania, and I went to a skills workshop in Disney World. Out here, you go to Disneyland, but there was Disney World. For me, it was just to get out of the winter, and there were two skills that we learned in that workshop. One was putting in bioidentical testosterone pellets. It was just men then, and the doses were a third of what we use now. And the other one was shooting the stuff in people's faces and getting rid of wrinkles that nobody heard of. This was in 2003, and that turned out to be Botox.
Yep, that was Is that when it came out? Was in 2003?
Well, it came out actually in 1989. It was only used for eye spasms. That's what it came out for. But around 2003 is when it came out for cosmetic use, and when I went back home, I had a good friend who was a plastic surgeon, and I asked him about it, and he didn't even know about it at the time. So now everybody knows about it. But then nobody did. So, and we used really big needles, and we got lots of bleeding and eye droops and all, but which we pretty much refined that now. So
well, you're very skilled at the faces, and you're very skilled at the hormones. I definitely feel a difference using your hormones and feeling better. And why, a question, why do men and women need hormones?
Well, think of hormones as the frame of your house. And if you have a good solid frame, we can go buy a rickety old chair from the dollar store, and you put it in that solid framed house, and 10 years later or 20 years later, the chair will still be there. On the other hand, you can go buy a $5,000 couch from Bloomingdale's with a leaky roof, and that $5,000 couch is not going to hold up very well. So hormones are juices. It's sort of our what gets us going and keeps us going. And whoever made us, whatever you believe, whoever made us played a big joke on us, and made it so that most of our hormones, we peak at around age 25 to 27, and then they start to dissipate after that. And at first you don't notice. By 35, 37, once some folks do. By 47, 25 to 40, 50% of us realize that things aren't quite the way they used to be. And usually by the late 50s, pretty much all of us realize that things aren't quite the way they used to be. And that's because the hormones stop producing. So, and we weren't supposed to live this long. You realize that, right? So my grandfather, who was born in Russia in 1885, he died when he was 50, and you died before I was born. And I have pictures of him, and he was an old man, and he was 50 years old. I mean, he looked like a 90-year-old now, or even older. Now these days, if you're 50, you're just getting started. So the hormones are what keeps us going, and what kind of gives us our drive.
And what are some of the symptoms that women have when they're in menopause? And then I like to talk about what men's symptoms are in menopause.
So in general, I mean, they're sort of all over the map. It depends on what, on which hormones are not being produced in adequate numbers, or if they're not being produced in the proper ratio. So that's always an issue also. So it's usually hot flashes, night sweats, brain fog. You start getting a little bit thicker or gain weight around the middle. You start losing memory. The first hormone that starts to dissipate with menopause, and so what I always say is that when we have our young ladies come to see me, ages 35 to 50, is progesterone. And the symptoms of low progesterone are agitated, irritable, can't sleep, poor libido, headaches, short-tempered. And so when a lot of these folks show up, they're taking, they've been given Xanax, Valium, Prozac, and whoever made us didn't make a Prozac deficiency. Progesterone, on the other hand, is a different story, and usually after about 4 weeks, all of a sudden the symptoms start to ease up and go away.
Oh, that's interesting. What about men? Do they go through the same symptoms?
Yeah, they do. It's been jokingly called menopause or andropause. Yes. And men, again, every decade after, or every year after, usually around age 40 to 45, they'll lose about 1% of their testosterone. And so testosterone is for it's an antidepressant, and when we measure testosterone, I can pinpoint and tell you at certain levels 148 for men total, and for women 22 testosterone. And women need testosterone, by the way. You'll start getting the signs of depression, anxiety, poor sense of self-worth. Poor muscle tone. You're working out, you're exercising, and nothing's happening. It's getting worse. Urinary issues for women, urinary incontinence. For men, it could be like a urinary dribbling. The prostate starts to get enlarged. The poor libido, poor sexual function. But testosterone is interesting because it's more than just for sexual function. I know that's what sells, but it's really universal, and it's one of the universal anti-aging hormones. On average, if you have adequate testosterone levels, and for men it's a total of 600, and for women it's about 30, you will, all other things being equal, live on average 10 to 15 years longer than if your testosterone levels are consistently low. So it's inversely related to blood sugar. It's inversely related to memory and cognition and Alzheimer's disease. Having adequate testosterone levels is extremely important.
Yeah, and I think it's one of the secrets of people. It's one of the secrets of anti-aging too.
Right, it's kind of the secret sauce, we call it.
And so we're going to be right back in a few minutes, and we'll get to the next section.
Have you, a friend, or family member been diagnosed with cancer? Dr. Forsyth at the Forsyth Cancer Care Center offers an all-inclusive program to treat adult types of cancer. The Forsyth Immune Protocol Cancer Treatment Plan, in a current prospective study of over 6.5 years and 1,200 adult cancer patients, has produced a remarkable 30 times greater survival statistic when compared to conventional full-dose chemotherapy. Greater than 95% of all their patients choose low-dose insulin-potentiated life chemotherapy, using only 10 to 15% chemotherapy dosing with insulin. Dr. Forsyth has long been considered one of the most respected physicians in the United States, particularly for his treatment of cancer and the legal use of human growth hormone. Located in Reno, Nevada, Dr. Forsyth has seen patients from all over the world. To schedule your consultation today, call 775-827-0707. That number again is 775-827-0707.
Hi, this is Eddie Floyd. Let me tell you about my favorite nonprofit public charity, Wainima Wild Horse Sanctuary, located on the Forsyth Ranch in Hallelujah Junction area. And please go to www.wainimaranch.com. That's WYNEMA.com.
Charbecue, the Butcher's Kitchen, would like to thank every customer for your loyalty and continued support through these challenging times. Call for takeout and delivery of rib tips, brisket, ahi tuna, roasted veggies, and much more. Charbecue is open from 11 to 7, Monday through Saturday, and delivers hot food safe and healthy. Call 499-5855 for details. 499-5855 Charbecue, as featured on diners, drive-ins, and dives. Get real. Get into Charbecue Reno.
Hi, this is Sierra Integrative Medical Center, and I have with me Dr. Bill Clearfield at Clearfield Medical Group, located in Reno, Nevada. He's in the Northwest. One of the things we've been talking about is the bioidentical hormones with you. And one of the things I really want to know is, can you tell us what kind of testing patients have to do to get their hormones evaluated? What's their first appointment like?
Well, we got to the point where we got so busy that we try to do the testing ahead of time so that they're ready to go. I invariably have a couple of month waiting list, so I don't want to have somebody come in and then test them, because we're not going to do any type of hormone optimization without knowing where their hormone levels are. So we'll do that ahead of time. When we do have it in, we'll do some of the routine things. We'll do a blood count. We'll do a chemistry. We look at their blood sugars, but we're going to look at 10 different hormones. There's actually 36 in the body. Some of them we can't really deal with. Some of them are minor. They take care of things like scars. We could actually do a whole facelift with different types of hormones. But the ones that we're dealing with as far as general health there's 10 of them. And so we look at them. We draw blood levels. You can also do saliva or urine. I sort of use that as a backup. I'm been doing it for a long time with the blood levels. So that's what we'll do. And we'll look at 10 hormones. We'll look at testosterone. We'll look at estrogen, which is actually 3 different types of hormones. We'll measure 2 of those. We'll look at progesterone. We'll look at thyroid. We'll look at growth hormone. We'll look at insulin, and we'll look at cortisol, stress hormone. Then there's 3 minor ones: DHEA and progesterone and pregnenolone. Those are the precursors to the other hormones. And then we'll look at prolactin, which is a hormone in the center of the brain, which can actually tell us traditionally if it's high, it's usually indicative of some sort of pituitary brain tumor. But what we're looking for is if it's low. We see a lot of patients with head injuries, and when they have somebody with a head injury will have very low prolactin levels, and that's indicative of an atypical either anxiety or depression. So depression and fatigue and anxiety are three of the main symptoms post head injury. It gives us a way to, one, know if there's an issue with it without having to do all sorts of extensive studies. And two, it gives us a way to follow it. And it's very easy and an expensive test. So those are the things that we'll do. We'll also look at vitamin D. We'll look at some inflammatory markers. So inflammation is one of the hallmarks of pretty much all chronic diseases. And occasionally we'll look at some specialty things if somebody's got something special. But that's kind of the general thing, general rule of thumb.
Yeah, and you're kind of looking at the whole body. And what I found is when you go and get your annual, your checkups done by your doctor every year, they don't even do that type of blood work.
For the most part, we're making small strides and small inroads. So, like I said, we look at everything through a hormone funnel. And by the time we get done doing our testing and doing our our histories and our evaluations, we've pretty much covered everything from the tip of your head to the bottom of your feet. It's just a very different type of philosophy, and when you do it that way, it's pretty hard to miss anything. That's kind of the way it's developed.
Now, what are the bioidentical hormones made out of? The pellets.
So these are plant-based. They're chemically the same as we make. The problem with hormones, and you have to remember, they're poorly misunderstood. They're misunderstood by physicians and lay people alike. If we're going to optimize your hormones, you want them to be the same as we make naturally. And the problems that developed and most of the cancers that you heard about, that's the big worry, came about because we were using synthetics. So in 2002, this WHI study came out that showed that the estrogens and progesterones caused a much greater incidence of breast cancers and uterine cancers than patients who didn't take any. And get off your hormones, they're no good. Now, dirty little secret, I was an OBGYN resident in 1978. We knew this back then. We didn't put two and two together. The synthetic estrogens were the most prescribed medication in the history of the world from then. That's kind of when I started, right up till 2002. I don't know why they're still available. They are, and if you read the medical literature, they're frequently confused with the natural bioidentical hormones. At first, the medical society said there was no difference; they're all the same. But over the last 20 years, it's pretty clear that the bioidentical plant-based hormones are much safer, much less cause much less problems, and we get terrific benefits. And if you know what if we know what you're looking at, make you deal with somebody that knows what they're doing. They're pretty safe. I mean,
well, that's the hugest thing. What you're doing is that you've been studying this for so long.
I know, like my mother used to say, I've been doing this long enough. I should know what I'm doing by now. So
that's why they call you the king of hormones in Nevada.
Yeah, that's the name of my fantasy football team too. So,
that's awesome. That's awesome. So, so tell me, like, how you give patients pellets.
Okay, so we do our evaluation like we do everything else. So pellets are plant-based bioidentical hormones that are pressed into cylinders, and the advantage of them is that they last a long time. So they last anywhere from 3 to 5 months for women, 4 to 6 months for men. And quite frankly, if we use them for a while and we kind of overlap them a little bit and don't let them run out, or dissipate, a lot of times we can get them up to about 6 months. So 2 to 3 times a year, we make we numb up a spot either in your low back or in your hip. We make a little tiny incision about 1 centimeter. It's not very long. It's shorter than the length of the nail on your pinky. We have an instrument. We put the pellets in. We either just close it with some steri strips, or if there's a little bit of bleeding, we'll put a couple of absorbable stitches in, so you don't have to come back and have them taken out. And then they go and do their thing, and usually they start you start to feel an effect within 4 to 7 days, as opposed to like hormone creams, which can take up to 8 weeks, and injections, shots can take 4 weeks. These work within usually 4 to 7 days. And they're time released, and so we know how much you're getting because we know how much we put in, and they're really terrific, and they really make a difference. The rate that they sort of dissipate or run out is pretty predictable. It's about we usually do testosterone for men and women. Women need about 1 milligram a day. So if we put in 150 milligrams, it should last about 150 days. Everybody's a little bit different. Some, use it up a little bit more. Some use it up a little bit less. And for men, it's about 10 milligrams per day. That's an average. So 1,400 milligrams. For men, they come in 200 milligram cylinders. So you'd have to put 7 of them. I think there's 300s now. We always used the 200s, so you'd have to use 7 or 8 of them, and then they'll last about 150 days, or it's about 5 months. They heal up nice, and away you go. So you don't have to worry about creams. Creams you have to worry about getting it on others. Children, goldfish, pit bulls, and spouses. You have to, if you travel a lot, you have to take them with you. Injection shots is the same thing. Usually with the creams and the injections, you never get the exact amount each time. We get pretty close, but never the exact amount. With the pellets, we know exactly how much you're getting. So if there are issues, it's much easier to take care of whatever the issues arise. And I like to say I pretty much made every mistake you can make with pellets, so we're pretty much good to go now. The nice thing about it is there's nothing that we do that we can't undo if we do run into a problem, and so we're able to really take care of folks the way they need to be taken care of.
Oh, and it's so wonderful once you do get the hormones. I think it's preferred that both the husband and wife get them. There's a lot of husbands that they say, I don't, like my husband's he's a doctor, I don't need them. I'm like, yes, you do.
Usually what happens is if the wife comes in and she gets them done, and then the husband will come back and say 2 months, call or show up in 2 months and say, you got to do one of two things. Either she's chasing me around the house, either take them out or give them to me. So you can't take them out.
Okay, we'll be right back in a few minutes.
At A Proper Fit Footwear in the Reno Town Mall, we've been accomplishing happy feet for over 30 years.
We offer a various range of shoe styles and sizes for both men and women. From all-season shoes and orthotics to work boots and safety shoes, our professional and reliable staff possesses the knowledge to help you find the proper shoes to fit your needs. Hard to find?
A Proper Fit Footwear is here to give our customers happy feet. We make people aware of potential foot problems as we're sizing their feet, suggesting the right arch support, and guiding them to the proper shoes for their needs.
Stop by A Proper Fit Footwear at 4001 South Virginia Street in the Reno Town Mall today, and allow the owner Mike Jones and our fabulous staff to find the perfect pair of shoes tailored to your specific needs.
A Proper Fit Footwear in the Reno Town Mall, the home of happy feet, where comfort and your feet meet.
Sliced fresh sandwiches every day, made right before your eyes. The port of Subway could be a smoking number 5 or a classic number 8, or maybe an Italian is your number 1 fave. Whatever you crave, prepare to fall in love. Sliced fresh sandwiches, whoa! Port of Subs.
The grilled chicken melt at Port of Subs will warm up your winter with savory grilled chicken and your favorite melty cheese on fresh-baked pepperoncini pepperjack bread, topped with all your favorite veggie toppings and sauces. Bundle up with savory Cool Ranch Doritos, a refreshing Sprite, and a classic chocolate chip cookie for a hearty meal that'll leave you feeling oh so satisfied. Available for a limited time at your neighborhood Port of Subs or order at portofsubs.com or on our mobile app. Port of Subs, we're slicing up the quality you crave.
Whatever yummy number you're dreaming of, sliced fresh sandwiches, Port of Subs.
Hi, this is Michelle Perry Roberts with Sierra Integrated Medical Center. I have Dr. Clearfield from Clearfield Medical Group. We are talking about bioidentical hormones. I had a question from an audience member. They want to know, how do they make the hormones so they're time released, the pellets?
So they're pressed into cylinders, and then they have a silicone wrap around them with tiny pinholes. And so it reacts with the body or your body tissue, and they just sort of like drip out, over time.
Interesting. Now, how do you give the patients the pellets? I know you do an incision.
Yeah, we make a tiny incision. We numb up a spot either in your low back or on your hip, and then we make a tiny incision, and we have an instrument that will allow us to put the pellets where they need to go, and we would just load them in, and we take the instrument out. There's a little bit of bleeding. We'll put some pressure on it. We use some steri strips and a clear dressing, or if there's some more bleeding, and I pretty much do this almost on everybody anymore, I put in 2 or 3 absorbable suture stitches so that there's no bleeding when they leave. We put on the clear dressing. I always put a pressure dressing on. It's kind of a overkill, but I was taught that by a German plastic surgeon way back when, and he told me he'd haunt me. He was about 70 years old. This was in 1985. He'd haunt me if I didn't do my dressings this way. So this is what I do with my students now. It's a bit of an overkill, but we make sure that they remember it's there, and at least till they get home. Once they get home, they can take that dressing off, and then they can shower with it. It takes 2 or 3 days for the incision to heal over, and then you're good to go.
Now, what will happen once the patient gets treatment with BHRT? What will they start feeling?
Well, again, so we're looking for for women, we're looking to eliminate hot flashes, night sweats, improve brain fog. Memory's a little bit harder, but that takes a couple of different ways to a couple of different modalities to try and improve that, but certainly that's part of it. And then the sort of the agitated, irritable, I hate my kids, I can't stand my husband, the perimenopausal symptoms, that takes about 4 weeks, and they'll start to dissipate also. And then libido, and energy, strength, and improve thinking. It will improve your blood sugar. It'll improve your cardiac function. If you exercise, it will improve your muscle tone. So there's lots of positives here.
And I thought one of the biggest one for women was osteoporosis, because it seems like we all get diagnosed with that it basically makes your osteoporosis stronger.
Yeah, well, it makes your bones stronger.
It makes it go, yeah.
Estrogen does that, but sometimes we have to be a little bit careful with estrogen. But believe it or not, testosterone will also increase bone density, and it's about as 90% as effective as estrogen without the estrogen, with testosterone to maintain bone strength also. And there's lots of drugs out for it, but they have lots of side effects, and they're pretty hard on your system. So anybody who's taken any of those bisphosphonates for you have to take a pill for once a week, and 8 ounces of water, have to sit up and for a whole day after that, and and then you end up with necrosis. You end up with your teeth falling out after a couple of years. I mean, I don't think that's a great way to go.
Well, and I think, you're definitely the hormone expert in Reno, Nevada. And we're going to, at the end of the call, we'll just definitely, like, to get a hold of the clinic, it's 775-359-1222 to make an appointment. Can you also tell me about your weight loss program? I've heard nothing but wonderful things.
Yeah, well, so I'm always looking for a better mousetrap, and a whole class of medications came out in around 2010 called incretins, and these were made for diabetes, and they were shots. They were once a day shots, and then they turned into once a week shots, somewhat time released. And every one of them, and there's probably about 7 or 8 different types, every one of them had a little bit of a weight loss component to them. And, it was kind of a curiosity. But the price was pretty outrageous, and insurance companies weren't going to pay for it for weight loss. In 2017, Novo Nordisk is one of the companies that makes one of these, came out with something called Ozempic. And I don't have a TV, so I don't watch TV or commercials, but I hear there's Ozempic is heavily advertised, it was it had 3 times the weight loss sustainability or capacity that all the other ones had, and it's at least 3 times the weight loss that you see with some of the more popular interventions like phentermine, which was a appetite suppressant. And so this was kind of a breakthrough. They did a whole bunch of studies on it. They found that on average, patients over about a year's time, on average, would lose about 15% of their body weight. So if you're 200 pounds, at 15%, that's about 30 pounds, which is actually pretty good, and it was pretty consistent. The problem, and then so the company came out with another form, same medication. The generic name is semaglutide. Same medication, but with different higher doses. And again, it's a once a week shot. But there's always a but. And the but here is the medical issue is that according to the company, 44% of the patients can't take it because of severe nausea. And it usually happens in the first week or two. And it doesn't happen right away. It happens maybe in the 3rd, 4th, or 5th day. And then the cost was $1,500 a month. With a discount coupon, you can get it for $1,350. Was the last I looked. And if you can't take it, it comes in a bundle of 4 because it's one shot a week. They'll give you 4 shots, and if you can't take it, they won't take. As you know, drugstores, they won't take it back. So for some reason, because usually these medications, when they're on patent, we can't get the generic version of it. But for some reason, we're able to get the generic version of semaglutide. And I work closely with a number of compounding pharmacists for the things that we do. And so we kind of, it was almost a year and a half ago, we finally got to get the post-COVID convention, and we hadn't seen each other in a long time. So we were actually talking about this stuff. We sort of kicked it around and tried to figure out, what were the issues with it? What can we do since we were able to get the raw materials? What can we do to make it better? And can we do it for less money? And the answer was yes. We could add certain things to it that were compatible with it. One was vitamin B6, which is what we use for women who are pregnant if they get morning sickness, and that was compatible with the semaglutide. And then we do, we use a lot of peptides. We use a lot of with our growth hormone derivatives. And so there's one called BPC 157, which has a strong anti-nausea, strong GI calming effect. And that was actually compatible with the other two. So we put the whole solution together, and we tested different doses. We couldn't use the commercial doses, which was 1.0 at 2.4, but we tested different doses, and we were able to come up with a 1.25. But instead of doing it as a once a week shot, what we did was we broke it down, and we make it 5 nights a week, but just a little bit, 0.2 of a cc, about the amount of fluid of say your thumbnail. So it's not a whole lot. And we use little tiny needles. You put it in your stomach 5 nights a week. And we were able to decrease the nausea rate from 44%. We have close to probably 500 patients on this to less than 4%. Patients couldn't take it. We have some other ways of dealing with weight also, but I've been doing weight things for 40 years, and I can tell you that this has been the best intervention that we've ever had. It is really consistent, and unfortunately, ladies, the men do better. It is what it is. I didn't. I'm just a messenger. So our guys can lose up to a pound a day. And women can usually lose on average about a half a pound a day. Now that's average. So we've had women only lose 5 pounds, but I've had some lose 30 pounds in the bottle of our solution will last about 5 weeks. I was the first guinea pig with this formula, and I lost 22 pounds in 6 weeks. Wow. I've been able to keep it off. It's been over a year and a half. What I didn't know, what we know now, is that if we keep using it continuously, it'll stop working. So it doesn't work on me anymore. But now we know that. So,
now, what diet do you recommend?
So again, some of it's preference. If you're a vegetarian, that's fine. If you're, there's the carnivore diet, which is all meat. I guess that's okay too. You have to watch your fats in that. We like either the paleo diet or the Mediterranean. Those are pretty close to pretty much balanced. And we actually have electronically online, we can send you menus, recipes.
Oh, nice.
Shopping lists. You can keep pretty much any statistic you want that has to deal with intake and output. And it's a pretty nice program. It'll run 30 to 60 days. And we can run it continuously. So we combine it with that for maintenance and for we do use something called AMPK activator, which is a type of a system that will increase metabolism without making you jittery. With the phentermine is really an upper, and it sort of makes you it speeds up your heart rate. Well, these don't. And we have a couple of carb blockers if you have a sweet tooth. We also like apple cider vinegar, about 2 tablespoons and 6 ounces of water if you have a sweet tooth. That seems to help. So all these little tricks, and then you need a little bit of exercise. So we like interval training for that. And then I always point our patients. YouTube is free for the most part.
True.
And all of those exercise programs from the 80s and 90s that we paid a lot of money for, like 8-minute abs and 8-minute legs and buns of steel and sweating to the oldies with Richard Simmons. You can get them all on there for free now. And, you can do 8 minutes. It's not going to take a whole lot of time. You don't have to go to the gym. You don't need any special equipment. And they work well. So we actually have all of our instructions on one sheet.
That's wonderful.
Easy.
Well, we are ending our show, and thank you so much for being on our show. So if you need to reach out to Dr. Clearfield, the number is 775-359-1222.
If you're living with diabetes and using insulin, you know the pain of pricking your fingers over and over again. Ouch! Well, by wearing a small remote device called a continuous glucose monitor